Alright, hi guys. I just wanted to do a story time of this incident that just kind of happened this year actually on Easter with my third child, Veda. It was the scariest, it was the absolute scariest ER visit to date that I've had with any of my children. Easter morning, I was cleaning the house. I was actually cleaning the kitchen. And when I clean the kitchen, I take all of my cleaning products that I generally lock up. I had them up on the counter. So I was cleaning the kitchen with them, and then Veda, she is 2 years old. She came and stood next to me, and I realized that the front of her shirt was wet, as if she had been playing in the water or she had been drooling or stuff like that. So I went to go change her shirt, and I told her not to play in the water. Within like 2 minutes of me changing her shirt, I realized again that the front of her shirt again was really soaked. So I knew something was a little off because she wasn't talking. And she speaks full sentences. She's very, like, I guess, mature for her age. And I was asking her questions like, are you sleepy, this and that, and she would just literally stare through me. And I didn't know what happened at the time, so I was kind of just gonna assess the situation, so I just told her to go lay down, and I had her lay down on the couch so that I could watch her from the kitchen. So she went to go lay down, and I noticed that her cheeks were full, like she had been like a chipmunk storing stuff in her cheeks. And then all of a sudden, she would just literally just like let all of the spit from her mouth that she had been collecting, and it would just go all over her shirt. She wasn't swallowing. So I didn't know if she couldn't swallow or what was going on. My first instinct was, oh my gosh, she got into the Orajel and her tongue and her throat is numb, so she can't feel herself, swallow or her tongue or anything like that, and she wasn't talking. So I actually got her some juice in a cup, and I told her to drink it, and I wanted to see if she would swallow that, because she loves juice. So I was like, okay, if she doesn't swallow this juice, then something is really wrong. And she would just like kind of pour the cup into her mouth, and she would just hold it there. And then she would just like spit it out after she realized that she couldn't swallow. So I knew something was really wrong, and it kind of freaked me out, but I was trying to stay calm because at this point I didn't know what happened or what went on or anything. It went through my mind that, maybe she had gotten into my cleaning products and drank some bleach or something like that. Like as a parent, your mind just goes like 100 miles a minute, and you just think the absolute worst. And that's what actually led me to bring her to the hospital, because I was like, if she did drink cleaning products, she might not wake up if she takes a nap. Of course, when I walked into the ER, they're like, what happened? I'm like, I don't know what's wrong with her. I know something's wrong, I don't know what's wrong with her. So I'm waiting in the lobby, and they didn't take too long. They took about 15 minutes from when we got there to when they took her back to see her. But in those 15 minutes, it literally felt like an eternity. And during that time when I was sitting there waiting, I text two of my friends. I text Brandy, and I text my friend Rachel. And I just told them both, like, keep Veda in your prayers. Something's wrong. I don't know what's wrong. And they're like, they both asked me, like, what are her symptoms? And I sent them a picture, which I'll insert. This is what she looked like, which is not my Veda at all. At this point, she was lethargic. She was, like, drooling everywhere. And they took her back, and I will insert, like, a video clip of what she looked like at this point.
Veda, Veda, you okay? Veda, are you okay? Veda, are you okay? Yes?
And the ER doctor came back and like kind of just looked at her, and she's 2 years old. So, naturally there are some 2-year-olds that still drool and all that stuff. So she told me, she's like, well, it's not uncommon for a 2-year-old to be drooling. And I said, it is uncommon for my 2-year-old to drool. My 2-year-old speaks full sentences, does not drool, nor has she ever been a drooler. So something is wrong. I don't know what's wrong, but something is wrong. And I kept updating both Rachel and Brandy during this time, like things that the doctors were saying, and like her progress, which at this point was like her regressing. Like she started going lethargic. She started just looking through me, just looking pale. She tried to throw up, but nothing came out. And I thought at this point, I told Brandy and Rachel, I said, she's either having a seizure, she is either swallowed a coin, or she drank some cleaning products. Those are my 3 predictions of something something that happened. Both Brandy and Rachel, when I sent them the footage, they thought like, oh my God, she had a seizure. But my other daughter has had a seizure before, and it looked nothing like this. But I understand like everybody's seizures can look different. So I was just really nervous. At this point, when I told Brandy that they told me that it's not uncommon for a 2-year-old to drool, she was like, oh no, you need to take her to the children's hospital right now. They let you go or they don't find anything, because something is clearly wrong with her and we need to find out what it is. It's probably like something neurological and we have no idea or anything like that. So I was documenting for that reason, because I needed proof to show another doctor. You know, if they had released me and just said like, oh, nothing's wrong, because this ER doctor kept like brushing me to the side, like saying, oh, it's fine. Her lungs sound clear. It's not uncommon for a 2-year-old to drool, and she's not running a fever. And those are the 3 things that she checked for, and she's like, oh, she seems fine. So I was recording because I needed something to show another doctor had, like, even if her symptoms cleared up or had she started progressing, I still wanted them, like, to show another doctor where she was in case it came down to that. So I finally convinced the ER doctor. I said, this is what we're gonna do. And I had to get like mama bear on them. So I told them, I was like, we're gonna get her an x-ray. If her x-ray is clear, we're gonna get her blood work and urine tests. And if that is clear, then we're gonna get her a CT scan, because something is wrong. And I know that something is wrong, I just don't know what. So they ordered her an x-ray. In that x-ray, I will insert that picture of the x-ray now. The x-ray technician said, like, told me to come here, and he was like, look, and he was like, your daughter swallowed a quarter. I just felt like the shittiest parent ever, because how does your child swallow a quarter? Like, I don't know how a child swallows a quarter. But he was like, actually this is the better of the 3 options. A, because we see this all the time. Especially around holidays. He said children tend to swallow coins thinking that they're chocolate coins. And B, he's like, it's a better option than her swallowing any cleaning products and or having a seizure, because that can be permanent neurological damage. So this is the best of the 3 options, which allowed me to like kind of like breathe a sigh of relief. And then I asked them, I said, okay, so what's the next step? And they said surgery. Because it was stuck right in her throat, she could not talk, she could not scream, she could not cry, she could not breathe. She was starting to she was lethargic because it was cutting off her oxygen supply. So right away, they took her back, they put her on oxygen, and we were gonna prep for surgery. So at this point, it was about, we had been at the ER for about 4 hours, and the ER doctor came back in and was like, when was the last time she ate? And of course it had been like that morning, because we had been there pretty much like it was almost dinner time. And she's like, okay, because had she eaten a lot later, we would have had to wait till tomorrow, because you can't put them under anesthesia, like having eaten. And that was kind of weird to me, because I'm like, my kid can't breathe. Like, what do you mean we will possibly wait till tomorrow based on the time she ate? Like, that seemed weird to me. But luckily she hadn't eaten since that morning. So we were waiting for the surgeon, because they're like, okay, we're gonna go ahead and call the surgeon to come in now. They needed to start an IV on her. Well, they blew both of her veins. when they tried to start the IV, and she was trying to cry and scream, but all you can hear is like something rattling in her throat, and it literally like broke me down. And so then the surgeon comes in, and he had gotten there, and he's like, well, why don't we gas her first before starting the IV, so it's less traumatic for her, like, you know, gas her, knock her out, and then start the IV. And I'm like, why didn't anyone else think of this? Like, why? That should be like common procedure with all children. I feel like you should knock them out, just gas them really quick, knock them out, start the IV, take the gas mask off, and they'll wake up. And they didn't even start surgery. They were prepping for surgery for so long, and they finally were ready about 10:30 or 11 at night. They told me that the whole procedure would take about an hour. Most of it would be prep and sterilizing, and then the procedure, they were going to stick a camera with a scope down her throat, and they were going to take the quarter out, and then he was going to go down to her stomach and just make sure that there was no other foreign objects in there. Took her back for surgery, and they told me to stay in this like waiting room because they didn't want her to wake up without me being there. And meanwhile, Aaron was home with the rest of the kids. And I was just keeping everybody updated via text message and all that stuff. So as soon as they were done with surgery, they called me back, and they're like, she's about to wake up. We need you there before she wakes up. So I rushed back there. As soon as I got back there, within maybe 5 seconds of me getting to her bed, she opened her eyes. So luckily it was like perfect timing. The doctor then showed me a picture and said, yes, it was a quarter. He kind of joked about how many quarters he's taken out of kids' stomachs and kids' throats just this year. He's like, I will be rich. Like, he told me not to worry and not to feel like a terrible parent, because like things like this happen all the time. Then he told me that we had to spend the night there, because anytime that they put a kid under local anesthesia, or anytime they put a kid under anesthesia, they like them to spend the night because they want to monitor them. And the next morning, before we were leaving, the nurse came in and gave Veda a little Barbie. And she was so excited for that, and she was back to normal the next morning after she got some rest, and I was so thankful for that. But the ironic thing about the Barbie that they gave her was, it said that it was for ages 3 and up due to choking hazard parts, like the Barbie like shoes and the little pieces it comes with. And I thought that was ironic, because she had just been in there because she swallowed something that was foreign. But anyways, we ended up going home, and she was perfectly back to normal the next morning. And it took me forever to even kind of just tell people about what happened, because I did feel like a terrible parent. But I realized that coins are something that you can find anywhere. Like, you can find a coin walking outside on the ground to go into the store, or you can find them in somebody's car in their glove compartment, or just anywhere. Like, coins are anywhere. But it's been a few months now, and I'm now able to, I'm at a place now where I could talk about it and share the story, because I don't feel like this terrible parent like I did a few months ago. And she's doing great, and this could happen to anyone, and I just wanted to share the story with you guys. Hope you guys have a great rest of the day, and I'll see you in my next video. Bye.